Hi, everyone, and welcome back to the Dear Asian Community podcast. I'm here with Dr. Phillip Cheng. Can you please just provide a brief background of what you do in your field?
Yeah. Hi, my name is Philip. I am a pediatric resident. I'm a third-year resident at Nationwide Children's Hospital in Columbus, Ohio. I've been going through to become a pediatrician, and actually starting this July, I will have finished pediatric residency, and then will be a fellowship or additional training in a specialty, it will be cardiology. So after June, and then years after that, I will hopefully be a completely trained pediatrician.
Cool. So, what really inspired you to pursue medicine?
Yeah, I think I always knew that I wanted to do some what sort of like avenue that took, sort of evolved throughout high school and college. I think in college, I really wanted to pursue a lot of my like broad interests, and that led me to do a lot of these from like my like core curriculum to be like a pre-med student, and then also my other curriculum in college to pursue like major. I ended up being like a history major, and so I feel like I went back and forth a lot on what I really wanted to do and how I wanted to go about quote unquote helping. And I think it wasn't until work and like help in a hospital setting where like the contributions that I was making to like a specific research group were actually like help going on to like help people in the future and possibly take care of them and possibly give them things like um, treatment and hope in their specific disease that really wanted me to like pursue medicine further. And so I think that was sort of the foot in the door. And then I ended up going through the process, applying to medical school, and then applying for residency. And then I guess everything just sort of rolled forward after that.
Are there any significant parts of like high school or med school that really stood out to you? Maybe more towards being a doctor.
I guess, yeah, I think one thing that was really impactful or profound to me in high school, maybe a little bit before that and leading into high school, was that my family was a very, not like very traditional, but pretty traditional like Eastern Chinese family. And that like we had our nuclear family, like me and my sisters and my mom. I grew up in the same house. And then also though my paternal grandparents also were in our house with us in Indiana. And so as they sort of got older, inevitably they started to get like sick or get diagnosed with other diseases. And it was really just like my mom and my dad who sort of took the forefront and being responsible for like their care and taking care of them and helping them through that time period. And I think that's like a very big cultural responsibility that I feel like they held, or maybe even just more personal responsibility. So sort of seeing that and seeing them take care of their parents made me want to like pursue a field that also took care of other people.
I see. Yeah. So I think particularly as Asian Americans, we are already influenced to pursue like medicine or like be a lawyer or engineer or things like that. And I feel like that's just kind of the way that some families are. And I completely see like how your journey was shaped by your culture. And I was wondering, how have your cultural backgrounds affected like how you work or like in the field? Has there been any discrepancies between, Western medicine and maybe your culture?
Yeah, I think maybe less so for me. I don't think there was ever like wasn't anything like necessarily like culturally or like familially influenced in
Mhm.
regards to like me like into medicine or being a doctor. I think that's sort of the path that I sort of ended up choosing and following for like my own reasons, and that I never really felt like undue pressure or an influence from my family or parents to go into like medicine just because of like our cultural background. I think there in medicine in general, when you're trying to be a doctor, at least in America, and take care of like a wide variety of patient populations, there are just like general discrepancies and basically just like everything. And where like how someone was raised, whether a different part of America or like a different country altogether, what cultural like practices that person does or believes in regard like specifically discrepancy between like Western or United States healthcare and sort of like more traditional Eastern type of medicine, there's always like things that pop up in regards to what specific like medicine or care or practice or like tests that a patient or family feels like needs to be run or what they want to be run, and versus like what your recommendation as their doctor is. And I think it's oftentimes there the responsibility is often, at least in the US, is like on the physician or on the doctor to sort of like bridge that gap or knowledge barrier or communication barrier or understanding barrier, to sort of describe why I feel like something is like the next best step forward or the next best step in treatment or the best thing for that particular person at that point in time, and hopefully come to like a mutual understanding in which the patient and doctor can sort of move forward together. I think that's just like medicine in general. A lot of the times, definitely, it's you can't really sort of make anybody do anything that they don't want to do. They're very like, you know, significant or like rare cases where it's like obviously if someone's in danger or their life is threatened, then like doctors take practice what we call standard of care in that situation, and then we sort of make decisions for that person and are protected or like shielded from like blame, just because that person's life was in imminent danger. But even in then, those I feel like instances are pretty rare, and even if you like you tell a family that like, hey, this kid is very dangerous and I have a specific treatment course and this will give you your best shot, they can still say no and say like they don't want to do that treatment for X, Y, and Z reasons, and you can't really make them. There are obviously some exceptions and like different things put in place to sort of protect patients, especially kids. If like parents don't want them to do treatment, but that treatment's been shown to be life-saving and things like that. But in medicine in general, I feel like is about sort of bridging those gaps, barriers to the best of your degree. And so the things that I witnessed myself between like I guess how I was raised and how I learned medicine and sort of or between that cultural background is no different than just like the normal things that I encounter on a day-to-day basis.
Mhm. Yeah, yeah, those are very good insights. So other than that, I was also wondering, did you always know that you wanted to pursue pediatrics, or did you like consider other fields before that?
Yeah, I think in my first couple of years of medical school, they might have changed this slightly, but it's basically just like your baseline education, and you do like a lot of different subjects and subject tests, and then you sort of lead up to this big test called like step one, or it's like basically your first board exam on your way to sort of becoming like board certified or licensed doctor. And then after that, you start third year medical school, which is when you sort of start your different clinical rotations and working in the hospital. And so going into that, I had a pretty open mind, I would say, and saying that I didn't really rule anything out and I was willing to do whatever and like practice whatever style of medicine that I feel like spoke to me. And then so basically what I did was that every like rotation that I went through, whether it was like this specific field of medicine versus this one, I sort of earmarked one that I like really enjoyed or sort of crossed off the list something that I didn't. And I think throughout third year, there were times I really liked specific fields that I wanted to like sort of think about more and try to do more rotations in that field. Initially, actually, I thought I really wanted to be a surgeon, and I thought that like the style of medicine that they like practice and being to like operate and do procedures and follow before and after that was really sort of like satisfying and could be really rewarding in regards to a relationship that you had with the patient. Like if a patient came to you with like a significant time period of like pain in their back, and then you then with something that could be fixed through surgery, and carefully took them through that process. And then if the surgery like was successful, then obviously that person was like very like appreciative of you. And that was something that you like one moment in time. And so I thought that sort of like our holistic type of was really cool. But then surgeons do work very hard and work a lot of hours just because you have to be trained medically and trained procedurally. And so often those that go on to surgery residency sort of dedicate a lot of their time both in work and outside of the hospital to sort of their residency program. And that type of work lifestyle or like work this wasn't sort of I guess I wanted to pursue further. After I sort of ruled like surgery, the next step is to sort of do like a non-surgical field or like a medicine field. And something that spoke to me, as I kind of like mentioned before, was like my pediatrics rotation. I think more so when I was doing my like cardiology rotations, and so I'm going to pursue further training in cardiology starting this summer. But I felt like that patient doctor relationship was just as much rewarding, and seeing patients and following them for long periods of time and taking care of them medically, both out of the hospital and in the hospital when they got sick, was really, really great. And then on top of that, you had the specific patient population in pediatrics. It's obviously kids, where they really need someone to sort of go to bat for them and to be able to step up and say the things that need to be said in regards to their care and really push that care forward. Just because like they're not able to sort of say those things themselves, especially if they're like really little or if their understanding is limited. Um,
Mhm.
and so I think that's what in particular drew me to the field of pediatrics.
So, were there any things that discouraged you on your journey to becoming a pediatrician, or are there any obstacles that you face now in particular?
Yeah, I think like the one of the most like things that's most commonly talked about, at least in like the doctor sphere, is just burnout. And that's sort of like the term of like being just like physically or mentally, emotionally like exhausted and not be able to have like any capacity to put yourself forward more. That leads to like a number of different things, like, not taking care of yourself, depression. They're like, you know, relative risk wise much higher suicide attempts and like suicide completions among like doctors than there are the relative to the rest of the non-doctor population. And so I think like the number one thing with doctors in training is that like how do you fight that and how do you sort of tackle that? It's different for everybody. There's no like bulletproof or golden bullet answer that otherwise like it would have been fixed. And so um, just taking time, I think, for yourself and sort of regard yourself against like what you see on a day-to-day basis. And the difficult part is that you just sort of do have to remind yourself that it's just a job, even though it's like a very like time intensive and job, and it's obviously involved with other people for every single hour of the day, and you really invest yourself into those people. Things I guess that like contribute to burnout, I would say like are the biggest obstacles, like tough patient cases, obviously patients passing away. On the pediatric field, obviously like kids aren't meant to pass away young, and so when they do, it hits hard for a lot of doctors. Work hours, just working a lot and having this like emotionally draining job is definitely something that contributes to burnout. And then I think a whole part of it is that like it's a job, but also we're on this in between where we're like considered to be training still, and I think that's still very valid, and that like it takes years to become an independent doctor for good reason, as like other people are putting their lives in your hands. And so you're expected to like go to work and do a job in which like you're salaried or getting paid to do, but at the same time there's this expectation of like getting better and learning. And so for all those reasons, lots of residents, I would say probably almost every single resident experiences burnout in some form. And then um, everybody sort of has their own way to try to tackle it.
Mhm, for sure. Yeah, that's very good advice. And I think more specifically as teenagers, do you have any advice for people who are still discovering their career paths?
Yeah, I would say find something that you enjoy and that you're passionate in, and that you can feel like you can pursue like logistically very well. I think that is different for a lot of different people. Obviously, from those that have a little bit harder time, like maybe like from a socioeconomic standpoint, options are more limited than someone that comes from like a wealthy family and can pursue other things a little bit more easily. But I would say in this day and age, there is something that you can always sort of tie to like your passions, and like say that your passions are sports or something like that, and you're not the top 0.1% of athletes in the United States that go on to become a professional athlete. Lots of people do jobs relate to that. They're sports medicine doctors, they're physical therapists, they're people that do data analysis for sports teams, they're people that do marketing for sports teams, they're people that do sales, they're people that like work like at the stadium, there are people that like design buildings for sports teams or like stadiums for sports. Like if that is like your particular passion, find your way logistically to get into that passion, I think is like the biggest word of advice. And then don't just like do something to do something. Um, if you realize that like a job is just a means to like a passion that you have, and maybe your passion is like spending lots of time outside in nature doing and there's only so many ways to like get a job or get paid to do that, then working just like a normal 8 to 5 job in somewhere so that you can have that passion, I think is more than reasonable to do that. And so find something that interests you and be able to stick with it, and then sort of find a way that allows you to do that thing, whether like involving your work with it or having work so that you can do more of that thing. I think is sort of like the biggest step forward. And if you're able to sort of, grasp that, then you'll have much higher chances of being able to like accomplish what you want to set out to do in the future without sort of getting disheartened or tripping up.
Mhm. For sure. Yeah, so it's very inspiring to hear your journey about your profession and the advice that you have. That's all the time that we have today. Thank you so much for joining me.
Yeah, thank you for having me.